Hello, and thank you all for joining us today. My name is Rafik. I'm Client Relations here at Prep Doctors, and I am joined by a wonderful panel, starting with our co-founder and Chief Learning Officer, Dr. Marwan Al-Reyes. Hello, Dr. Marwan.
Hi, Rafik. How are you?
And we're also joined by our NDECC Clinical Skills Program Director, Dr. Ban Alani. Hello, Dr. Ban. Good morning.
Hello, Rafik. Good morning.
And last but not least, we are joined by our NDECC Situational Judgment Program Director, Dr. Fersan Marei.
How are you, man?
I'm good. How are you doing, Dr.
I'm doing
Fersan?
fine. How's everything?
Awesome. So I would like to thank you all once again for joining us today. We'll be discussing the recent the recent NDECC results that were released, the passing rate, and the effect of the Prep Doctors Roadmap on the Prep Doctors results. So I would like to start with Dr. Marwan. How do you find the recent results that were released?
Actually, I'm not going to only discuss the recent results. The recent results are amazing, but I want to actually educate people and make them aware of what happened since this new exam was implemented.
Which was around last year.
They started in September. The execution of the exam started, September 2022.
Mm-hmm.
And the exam is being assessed 4 times a year. So until now, we have 4 cycles of results. So these 4 cycles of results, we have been closely following the statistics in order to help people pick up the learning curve as fast as possible. Mm-hmm. Especially that the nature of the exam changed, the strictness of the exam changed. There's a totally new component that was introduced.
Yes.
And people also they can't wait forever, so they actually they have a limited time to train. So what I'm going to start with actually is we'll focus on one exam at a time, because the NDECC is divided into the situational judgment and the clinical skills. So currently our stats are amazing, the last cycle, so we're proud actually to see that the effect is there, but we are also pushing to get better over time. So that's the idea. But it's good actually that people can see what's happening with the pattern, what's going on, because the volume is in Prep Doctors, and the stats are actually based on 406 candidates who replied in those 4 cycles to our surveys. So we are trying to actually analyze, so we're looking at an average 100 per cycle.
Yes.
So if I can get the plot of the statistics.
You need this image, right?
Yeah, image, the first image, if you can, yeah. So that's on. So if you look here, this is actually by cycle. This is cycle of results, and we're looking at 4 cycle stats. We're going to focus on the red line, which is the clinical skills, and the blue line is situational judgment. So as you can see, the clinical skills is lower, and that's what people have been experiencing, and they're actually stressed out more about this exam. So we want to tackle it. So if we start and look at cycle 1, the passing rate, and what we're talking about here is the Prep Doctors passing rate. We're not talking about the NDEB. So the passing rate was hovering around the 50%. It dropped below 50, and it stayed below 50 for 2 cycles. Then it picked up to get close to above 65. So it's around 66. That's in the last cycle. So that's a huge jump, as you can see in the curve. And when we look at what was actually happening, because this exam was implemented recently, it's not yet 1 year. It hasn't passed a year yet. Yes. But we feel it's like 10 years when we're talking in Prep Doctors and the evolution of things.
Yes.
Well, one of the challenges is this exam is conducted throughout, so there's no set date as it used to be before. And when we look at the pools and we try to analyze what's happening, the first pool, the first cycle, it was the COVID pool. These people have been waiting for months. They're fatigued, they're frustrated. They came to know that you cannot fail a single project anymore, because the people before them, they wrote in December 2021. And then there was a gap, and they started by the end of 2022. The exam was re-implemented. So these people have been training for longer than normal.
Yes.
But the problem is there was a panic, there was a stress, the fear of the unknown, the fact that there's no leeway for mistakes.
Yes.
And the stress of how do we book for the exam, and are we going to get seats and so forth. So that's the first group, and the situational judgment will talk also how they also were going first time into the unknown.
So many challenges, yes.
Now after the first group goes and the information, people start to know, oh, okay, this is a stressful exam, first set of statistics starts to come out, it creates more panic. Now here we started to deal with candidates. Because of the chaos, it became actually tough to guide the candidates in that phase. We were struggling actually to advise people, because for us it was very clear. Before COVID, people used to train minimum 6 months, some of them 9 months for a single exam. Now we started to see in the cycle 2, people are rushing, they're training 3 months, the percentage of people training 3 months for 2 exams. And I don't blame the people here, but the problem that was actually creating this panic is the limitation in seats. So the phobia that people had was, I want to get a spot. So after I get a spot, I'll figure out what should I do. So then they get a spot, and then they find out they're not ready, and now they have to go, and so forth. So there was a panic. And also we'll talk later on about situational judgment, how in the second group the pattern started to change. People started to memorize, they lost the communication component. The first group were behaving more like a regular dentist.
Yes.
So there was a dip. And that's when actually, when we were monitoring this and the way people were going, we started to actually develop the roadmap. And the roadmap, the whole purpose of the roadmap was to actually guide people, to put them under pressure so that they can learn faster, but they learn with guidance, and to give them measures so they can actually know they are ready or not. And with Dr. Ban, we'll talk later on about how this is now actually, some people are trying to find loopholes in our roadmap. But yeah, but that what happened. So the effects of the roadmap are not full yet, because people who are with us now, they're actually using it the most. But there were people on individual level, they started to follow. And now what we see is in cycle 3, the roadmap did not have an effect, because it was just implemented towards the end of that. But in cycle 4, we can see clearly what's happening. We can see clearly what's happening. And this is, by the way, these stats are not looking at those who followed the roadmap. We're looking at general. So we said the general passing rate in Prep Doctor went up to over 65%, the general.
Yeah.
Now, if we actually start to look at recommendations and performance in mock exams, this shoots high up.
Higher. Yes.
Our goal actually is to improve both the general and the recommendation. But one thing we are starting to become like strict and firm with people is, if you're not ready, don't gamble, because it's not fair to you that you're going to put yourself in this trauma, because it's pretty clear that this is a strict exam, you have to pass every component. And at the same time, in terms of statistics, you're going to the exam not ready, you're just actually adding. So we want to see, because clinical skills have multiple variables, by the way. It depends on how much you train, you're ready or not, and then what goes on in that day. You may have a bad day.
The day of the assessment.
Of the exam.
itself.
So just to conclude the statistics of clinical skills before we start discussing the roadmap, if you can, and then just push over the table.
Yeah, it's on.
Okay, so I'm just gonna have to flip over here. Okay, so this is actually something that we had a webinar before, and that's when we accumulated the statistics of the first 3 cycles, and we came out. So we were looking at the pool of people who passed. What do they have in common? Those who pass the NDEB exams.
Okay.
If we look at these people, how did they actually perform in Prep Doctors, and what do they have in common? So the pattern was actually clear to us from the beginning, but we compared cycle 4 to the previous 3 cycles. So those who actually had more training, more 6 months and more training, the percentage of those who pass in cycle 4, it's 95%. So 95% of those who passed, they trained more than 6 months, 6 plus. 92 before.
92.
So it's an increase,
It's an increase, yes.
but the pattern is actually confirmed.
Yes, it's evident.
It's confirmed. Now, if you look at those who are taking less training, it went from 8% to 5%. Now, this is a good pattern in the sense that people are realizing that this needs training. Also, it answers the questions. We always get some people who want to go in 1 month.
Yes.
How I can do it. Okay, you believe in, I'm not saying it's 0%, but we're talking about probability here. But what's more important in the statistics is the mock exams. We started to see that the performance in the mock exams is very crucial to actually act as a measure of how they're going to succeed or not. And when we say performing well, we're not saying they're going to pass all the projects in our mocks. We're looking at someone who either passed or failed 1 to 2.
1 to 2 projects out of the 7
Out of the 7 projects in our mocks. So that went up to 98%.
Oh, so it's a very clear indicator.
Yes. And when we started to introduce the committees, by the way, the pattern became even clearer because we meet now with candidates on a monthly basis. When you meet on a monthly basis and you sit with the panel who have been monitoring these candidates, by the way, they know, they tell you this candidate is ready and they pass. This candidate is not ready. Okay, so a lot of those are not ready are starting to listen, which is good. But those that the work was good and the majority passed.
Passed the exam.
And people felt it in the market. And this is a good thing because before, what happens when people don't succeed, the first thing is they start to blame is they're strict, it's impossible, and that's the rumors that start to spread. But last cycle, I started to get people who say, oh, by the way, it was good. I had 5 friends that passed. So that's motivational. People start to believe now, no, this process can be done, but you have to be systematic in the way you approach this process. So I'm very happy with the statistics we have. And I think people now are starting to gain more confidence because their peers affect them the most.
Of course.
And what I advise people going forward, talk to those who succeed and follow what they did. They're going to give you the right advice. And to those, unfortunately, who didn't, I know it's traumatic, I know it's tough, but it's doable. So just reorient yourself and you can actually go through this process. It's proven now, and there's a significant number of people who went through this process, so it's not an impossible. Exactly.
So if you want to, maybe I'll direct this for Dr. Ban for the clinical skills component of our program. We have so many resources and tools to help such students succeed in this process and be able to clear it. So if you want to walk us through the resources and the tools and what do we offer in our clinical skills?
So we offer from beginning we offer the lectures, the live demos, live streaming demos. We have now increased the lab support, the presence of instructors on floor with the students and with the candidates. So it helps them. What I want to mention, and this is like advice also from us, because some people they come to our instructors during the lab support, they want to do work check. It's not about work check. We do have twice a week work check. So we want them to utilize those sessions, the lab support, if they have any weaknesses, anything that needs to be improved. You can approach your instructors. They can help you. Whether how to correct this project, how to get the best tool to navigate this project. So this is what the lab support is for. Now also we notice.
Is it if I interrupt just for quickly, just to the lab support, what Dr. Ban was saying is very important in the sense. I want to give an example because people they actually misuse it. A lot of them they want to see how do you do the project. Okay, and that's a live demo. Dr. Ban already did 2 live demos in the beginning. And when you see how the project is being done, it always looks easy in a live demo. It looks easy, the lecture looks easy. And then they start doing it, and then they get in trouble, and then they don't pass that project. So to give an example, let's say they do the crown preparation, and the distolingual angle, let's say, for an upper molar is always they're struggling with, they over-taper it. So they go to the work check, they tell them this is a fail, this is over-taper, as an example. Then many people, and this is very important, they go back to the lab and they want to see how the crown is being done. No, the lab support is not to see how it's being done right now. Prepare your crown and leave your weakness and ask the person who's on the floor to show you how to tackle that specific weakness you have.
Exactly.
So that's how you utilize the lab support, because if you see it all over again, you're going to lose focus. You know how to get the buccal, you know how to get the lingual, you know how to do, let's say, the mesial, you're struggling with the distal. So prepare 75% of a crown and then go and get the support instructor and tell them, this is where I'm struggling. Target specifically. And that speeds up your learning. You have to diagnose your problem, and that's what the work check they do.
Exactly. Yesterday, for example, I did live demo. I went to the to our candidates. Anyone has a question? No, it looks easy when we see it, but we have to try. So yes, they have to try. So there's no point that I ask the lab support instructor to redo a demo, but help me how to correct this, how to avoid this, how to how to get the right position for this project. Yeah, that will improve their work. Yeah.
And if I want to add one thing, it's usually like for me basically when I look at the practice, like I can learn from the demo, I can learn from the lecture, I can get notes from the doctors who are doing the work check and who are doing the support, but I need my own time to learn. I have to sit and start working on the project on my own, because this is where like the maximum amount of knowledge I will imply in that way, and as well as really trying to get to the way, because at the end of the day there is not only one way to do a project, there is also the learning curve of it as well.
Yes.
So
yeah, indeed.
Now, one thing, Dr. Van, because you've been following with the instructors, and they're divided into panels now, so people rotate. What is one of the, like if I ask you a question, what is a positive that you have seen that happened since this was implemented, and what's some alarming signs or something that you want to actually...
Yeah, it's a good question. The positive thing is that now you rotate within like a committee for a period of time, so they know you, they tracking, they know your weakness, so they know when you come for the next time, like I know this person always end up having like over convergence in that distobuchal wall, so I want to look for that mistake to improve it. So this is something like the trackability is something positive. You know the mistakes and how to help that person to avoid those mistakes. But recently, because like the instructors, like we are always in meetings with them, so some instructors, they reported that some people, they are coming to the work check, they don't want to document their results because they want to
impact the recommendation.
Exactly, with the committee.
Yeah.
So please don't write it down.
Try to find a loophole in our recommendation.
Yeah,
in
so
our recommendation. But
yeah,
like
they pressure the instructors that, okay, I know this is not good, so don't document it, because we actually give them tasks. We say, okay, every session you have to show 7. Now, you have a week to work on that, or not week, 2 or 3 days to work on that. You can work extra hard, and you have all the leeway. If you did a bad project, throw it and do it again. But when you come to the work check, you have to show the best one you have achieved in those 3 days. If you happen not to achieve a good one, we need to know.
Yes, and it'll be documented
Exactly.
too in your progress.
Exactly.
because this will affect on our recommendation later on when the end of that cycle, like that month, or let's say,
yes.
yeah, exactly, it's gonna affect on the like actual progress of the person. Like it's like we're deceiving ourselves, you
Yes.
know.
Yeah,
Yeah.
they wanna. Some of them, they even when I used to sit with the committee to talk to some of the candidates, they had a star in some of the candidates, and they used to say, please don't tell us not to go. Like they don't want to hear that.
Yes.
You know. So I mean, it's okay. I respect that people under a lot of stress. I respect there's a problem with booking the exam. That's a lot of stress for people right now, is booking the exam. The way the booking system is established by NDB is not helping people actually plan to go to the exam well, so they're limited, and there's no clear picture for a year ahead. Like the NDB, they open a cycle by cycle,
It's
and
sad.
it's
sad.
it's ridiculous. By the way, this has to be
frustrating
fixed.
to
This is
people.
something that needs to be fixed. This needs to be. There should be a full schedule for a whole year, and people can pick, and there should be enough seats for people to do the exam, because it's unlimited. It's supposed to be unlimited in 5 years.
5 years, yes.
We already know that it's down to 4 times per 5 years, but now it's not even 4 times. Some people, by the way, they cannot do more than once per year, based on the limitation
Because
in the
they're
seats.
waiting.
Yes.
So I mean, that's not accurate in terms of the description. You cannot say something is unlimited and there's no seats. So that's a problem, and I believe that the NDB are working on that, because last time Dr. Luca mentioned about that. So hopefully this is something to be on the positive side, something that can be resolved, and more seats can be available for people to actually do the exam. I would just want to comment on one thing, and this is something that is new, is we're implementing LMS, a new learning management software, and this system is going to be in effect soon.
Yes.
The nice thing about this system is to actually, because till now the tracking is paper, and
Manual.
now people will have profiles digitally, so they can see their performance by the work check.
Oh, that's exciting.
They
news.
can see it, and the stats are going to be very clear, so they can monitor themselves, and we also are able to monitor them. So
And
we're
every
excited.
student will have their own like portal.
Their
so
own
they can
portal.
Track. Is it project by project? Is it month by month? Can you touch a little bit more on it?
So the way it works is that every candidate is going to get a portal, as you mentioned. And that portal, every time a work check is done, it's done on the portal, so that immediately they can go and see how they performed in the last session, because that's important for them to know what to focus on next.
Yes.
So let's say if they're passing composite resin filling, MOD, if they're passing, let's say, the endo, but they're struggling with the class 4 or PFM, they know, okay, last session, this is what I got. They don't have to remember, or they don't have to go to paper. It's all on the system.
I just want to add one thing. It's not only that, they will know exactly which mistake is the most common or the most happening mistake they
So
always
we'll be
get
able to
for
generate a
each
report for them
project.
to go back and look at.
Yes.
Wow,
It's
so
actually
good.
graphs. You will have a freedom of
Yeah,
doing multiple
it's
things.
actually it's an amazing system, because like let's say they have been struggling with PFM, 11 PFMs they did not pass. They can go and see, okay, what was the reason they failed, the most common reason, and then the system is going to check the rubrics, and they will show that, oh, it's unsupported enamel in 7 out of the 11 times it was this problem. So this way it can help the
I
candidate
think,
know.
yeah, it helps us also to like track the even the performance of our instructors, right? Like, because
For us, it goes both ways. We will
Exactly,
be able
like-
to know.
Also from the instructor's side, or the
Exactly,
doctors
yeah.
are teaching this course, they'll be able
Yes.
to track their evaluation process.
Instructors
how it
can
works.
track instructors, but the idea is when we track the instructors and they track each other, it's gonna be very easy. For example, when they start to rotate through committees, that the second committee who's meeting the candidate,
They will know more.
easily they'll know what happened in the
Exactly.
first
The
committee,
handover.
because
Exactly.
the handover is gonna be
Yes.
smoother in
Yeah,
that sense.
so-
Yeah.
Wow, okay. And one more thing I want to touch on. You mentioned earlier that a crucial part of our roadmap is actually your performance on the mock exams.
Yeah.
Can you go back and touch a little bit more on that?
Okay, because what I meant is the first issue we had was people not training enough. Okay, which now I feel is actually tackled.
Yeah, the
So
pattern is
the
improving.
pattern is changing, and you
Yes.
in being in facing the clients, you can see
Yes.
that. So people, it's restored now that people understand this is an intense exam, and I need time to practice for it. But what's important is, okay, yes, you are going to train more, and you're willing to train more, but some people, I don't want people to think, okay, I gave it 6 months, that's it, I'm going. No, you have to train more,
yeah,
and you have to push yourself
lessons.
to prove to yourself that you can pass before you go to the exam, or you can perform well. So what's going to happen, and I can see the shift happening right away, is the percentage of the 3 months is fading. We don't see these anymore.
Yes.
More of the 6 month.
Yeah.
But what's left now is follow the roadmap. Keep following the roadmap. Track yourself. Push yourself. If you want to go to the exam, it's in your hands to push yourself. And the way to push yourself is to actually know where you made the mistakes, to perform better, improve your statistics. And by the way, when I tell people, if you do a bad crown, throw it and do another one and show us the best one. They will say, well, I'm affecting statistics this way because you didn't see the bad one. No, I'm actually pushing you to generate the best of your abilities.
The best
And that's a motivation.
Yes.
So you have to generate the best of your abilities, and I know you're capable to, but now when you're under pressure, you're gonna do it. And when you show it to us, there will be a reward, because when you pass and the statistics start to improve, you also push yourself. So it's a combined effort by both, by us and the candidate,
candidates.
to actually push themselves so they can perform better. And although that I talked about the statistics and I'm happy, but I'm not very happy yet.
And why
Because
is
we
that?
have to, because we wanna, it's not, we have to push it
We
even
want to push
more.
it more.
We want to push it more. Before the new system, the passing rate of the skills became much better, and at the end of 2021 we had a extremely high passing rate of
Yes.
skills, and that's what we want to get to. And people will say, well, at that time they were allowed to fail a project, that's why it was high.
And it was
Well,
2 days and we had more
it's
time.
okay,
True.
it's true, but I mean, people are always capable of beating the passing rate. Like,
Yes.
if you do it right, you can, and I'm pretty sure this can actually improve.
And we can see that now. You see over
Yes.
the 4 cycles, especially the last 2 cycles, when people get to know what
Yes.
exactly is happening, it's on rise all the time.
Now,
That's very
the last thing I want to touch upon in clinical skills is to address this to Dr. Ban. The education, the pace of the course now is fast.
Exactly.
And we have started to implement tools to help people so that they can keep up because the pace is fast. So what tools have been implemented
So
in that
people
regard?
in the past, they had that luxury, like rewatch the lectures again and again. Now they have another thing, like another course to focus, the situational judgment. So
component,
they
yes.
have very limited time. They are divided between practicing in the lab and then
Practicing for situations.
situational. Yeah,
Lectures
we know
for
that's heavy.
situational.
We ask people always, like we tell them in the beginning of every course, like once today's lecture is going to be for you, maybe a lot of things doesn't make sense in the beginning, as long as like the minute you start practicing, you will know what we're talking about. In the beginning, it's overwhelming, a lot of information within that
Yes.
2 or 3 hours lecture, but a lot of things. Okay, watch it. I'm not expecting you to absorb like more than 20% of the information,
yes,
and this is
knowledge.
like true. It happened to all of us when we started the skills.
Yes.
Start practice. After a week or two, you're gonna face problems when you work with the different projects, the position.
actually
Go
see
back,
what we
watch
mean
the
in the
lecture.
lecture.
But the fact that they don't have time to rewatch it again, we're trying to help. We have now, like we have the tablets next to their station, so they don't need to book
Yes,
in the
iPads
lab.
at every single
Yeah.
station.
So they can rewatch even the demo while they are working. It's close to
yes.
them now. The other thing we're working on, I'm working on a project like short videos, so that will summarize everything. It's about 6 to 7 minutes. We'll show you how to evaluate your project according to the criteria. You put all the criteria, so in case you don't have time to rewatch, which I still highly recommend, but those videos will be a great help.
It's like a shortcut.
So it'll be a
Exactly.
series of short videos for every project.
It's going to be
or
released soon.
Yeah.
Yeah, we're
Yes.
working
will be
on this
released soon
project.
to every student.
Yeah.
Wow, this is amazing news.
Yeah.
This is
so-
I think this will be a very helpful tool actually to add.
Yes,
Exactly.
we're constantly
The
actually
resources.
Yeah.
trying to develop tools constantly to help people speed the learning process. The challenge that we're facing now is the time. We're fighting with time. It's like we have to speed the learning process for people so they are ready to go to the exam, because people, the more time they spend in training, it's going to cost them more.
Yes.
It's going to be draining emotionally. They have families, they have kids, stuff are going on at home.
Yeah, there's
you
a
know.
whole life outside.
There's a whole
of
life outside.
this
So
one exam.
so we
yes.
want to push that learning to be as fast as possible in the clinical skills. So that's why we implemented the tools. But one thing, and to wrap up with the clinical skills component, just to wrap up,
Mhm.
it is very important for a positive attitude from the candidate. It's very important for the candidate to acknowledge, and by the way, now I feel like I'm teaching situational judgment, but I mean, it's very important for the
That is,
candidate to acknowledge and know the limitations they have. That's the first step to learning. And the other thing that we hear from instructors is someone will say, oh, the PFM crown is not working. This is not a good statement to be in, because you're not going to learn much from this statement. When you say, my PFM is not good, okay, here, I'll show you how to do a PFM. My PFM is not good, I'll show you how to do. No, it should be, my margin is not good, or I'm having difficulty with the buccolingual taper. So what the attitude and the philosophy we want to implement is, as you're practicing, you have to start to check off the positives and focus on what's left. So, and you have to guide the instructors to help you. You're the best one to guide them. So you go to the support instructor, you're like, look, last work check, they told me my margin was good. They said that the reduction is good. I'm having a problem with the taper. What are your tips on the taper? Now they can actually get the tips and go to one instructor, go to the second one. There may be multiple approaches, see which one works for you. But you have to be actively pursuing that to improve
You have to be
yourself.
specific
Yes.
on the areas of weaknesses.
Of
that you have.
weaknesses. So you have
Okay,
to
that
actually,
makes sense.
and the LMS will help them as well, because there's a tracking in the
Yes.
background.
And
Yes,
statistics
details.
and number
And-
of
By
and-
column.
And use the tools, because practice, yes, you have to practice, but you also have to have the theory and the knowledge behind it. And it gives you a break, by the way. Like, to give you another example, if you're doing MOD and you're ruining it every time, it's worth blocking 2 hours of your time to go watch the lecture again and the short videos. That will take the stress off you of doing another bad MOD. And by the way, I don't recommend people to keep repeating the same project because they get stuck with the mistake.
Exactly.
Take a break from that project.
Yes.
Watch again the videos.
They go into tunnel
watch demos.
vision, yes.
Do something else.
Absolutely.
And that's gonna speed up the process because you'll be like, oh, okay, now I see why this angle is not working. And instead of, okay, I'm gonna try again, and you're repeating the same mistake. And according to studies, it's shown that when you repeat the same thing and you have a defect in it, there's a very high probability you're gonna repeat the same defect. You have to disconnect from that defect. So as an overall, for those who are with us in the roadmap, because I know people with us in the roadmap, they're attending and they're watching, please utilize the roadmap because there's heavy features that have been implemented. We start by lectures. Watch the lectures. You don't have time, make sure you watch the replay. It's very important. Attend the live demos, but they all get recorded. You can attend them again. Utilize the lab support. Utilize everybody in the lab support. So some of them, they like some instructors more than the others, and that's normal. Like everybody has a favorite. But even if you feel that, oh, I'm comfortable with this instructor, go to the other one because you never know. It's just a simple tip can actually make a huge difference for you.
Yes.
And the work checks, listen, and don't focus on, because some of the comments we get, oh, I went in and I'm like, my psychology is now so down, I'm actually emotionally deprived. No, actually use it as a motivation to improve. But how do you use it as a motivation to improve? Two things. Listen to the feedback and learn in baby steps. Don't learn in one shot, and this is very important. Don't learn everything together. You're not going to master anything.
It's going to be super tough.
Baby steps and keep doing everything. Baby steps and keep doing everything, because we have two things in this exam. I have time to perform 7 projects and with infection control, and I have to pass all of them. So if I want to train, I'll be like, okay, I'm going to focus on these 2 projects, MOD and Endo today, but I'm going to do all 7. Why I'm doing all 7? Because doing all 7 is going to build the stamina. I'm doing 7, okay? And that's not in the beginning, by the way. I'm talking now about when they become more advanced, as an example, so people don't misunderstand it. When they're learning new projects, they're not in that phase.
We said the learning curve.
The learning phase is first 2 months. This doesn't apply, but I'm saying when they're practicing and they want to pick up a learning curve, and let's say I got to a point I know everything now, so I'm going to start to do all the projects. It's a good habit to say, well, I'm going to do all 7, but I'm going to focus on 2. I want to pass 2. But I'm gonna do 7. Why I'm doing all 7? It's a stamina. I'm gonna build the stamina. I'm gonna know what's involved in finishing 7 in 8 hours. But I'm focusing on 2 to pass because I only wanna learn those 2 now. Once I master them, I'll add 1 more. But I keep doing 7. But the problem is if I do 7 and I'm panicking on all the 7, I wanna pass all the 7.
You're not gonna be able to.
It's gonna be very difficult.
You're not gonna add to your learning curve.
Yeah.
Wow, this is very important. So it seems like our skills course is a pool of resources.
And don't skip the committee meetings. Don't skip the committee meetings.
They skip them because they don't want to hear.
They don't want to. Don't skip them. It's good. Come see the feedback. You get some tips, and it's done monthly.
Yeah.
Not for new candidates. New candidates, we start to see them after 3 months. But once you start to enter into the committee meetings, don't skip them. Don't skip them. And when you go from one committee to another, it's important now you have a new set of instructors to learn from, so positive attitude is very important. So as I said, there's tons and tons of features. It will take hours to explain them in detail, but for those who are with us in the roadmap, we are here. If you want to utilize it, ask us, how should I utilize this feature? And don't ignore it. You know when you buy a luxury car and it has tons of features?
Yes.
There's 2 attitudes. Just do what you're used to, and you paid for something you're not going to use, or actually learn about the new features and you're going to make your life easier.
Exactly. As a car guy myself, I learn about every feature before I even start driving it.
Okay, I just first want to touch upon the fact that anyone who's watching us, they can send us questions. We will try to also answer them as much as we can. Just remember that. I have a question from Dr. Nadi here. He's asking about, what about the people who failed 1 project in each cycle? Can you share your thought, please?
Failed 1 project in the actual exam or in the mocks here?
I think what they mean is they failed multiple time 1 project.
One project?
In the exam itself.
In the exam,
That's how I
okay.
understand it.
Okay, this is a question that I always address, by the way. Very important
Yeah.
question. And this comes to consistency. It's a consistency issue, and it's the stress on that day.
That's true.
Now, can someone who passed the marks here and do well still not pass the exam?
Of course, you
Unfortunately,
cannot-
of course.
yeah.
As I said, it's that one day, the stress and so forth. But the first step is, are they failing the same project, or are they failing one different project? Like first exam they failed PFM, second exam they failed, let's say, class 4. If they're going through that pattern, then there is just a matter of consistency, which means their target in the mock exams here is pass everything in a row to prove to yourself, to regain the confidence.
Yeah.
And one thing that people get stuck in is, I don't know why I failed. I don't know, and I'm pretty sure majority they know.
Yeah,
They know.
but you have to understand them after all of this. Like,
I agree,
Yeah.
but I mean, I'm being a realist here because they have to get the right advice on how to proceed with this. So there's two attitudes: is I did the best class 4 and they failed me. Okay, how? Nobody can help you.
yeah, unfortunately, we
nothing
don't
to
know.
say.
We have no
Nobody-
information.
Nobody can help you because nobody knows what's your actual class 4 and how it looked like. You are being subjective. You have to believe that since you did not pass this project, there was something. Okay, there was something. So let me continue and see
Yes.
how to tackle it.
Yes.
How to tackle it is to come back and to improve, and even what you used to consider as minor, make them a major. That's because, okay, minor detectable margin, let's say, a minor detectable margin is allowed. So you were banking that this is going to go through. I didn't go through. So if I'm going back, I'm going to say, no, a minor detectable margin now for me is not a
It's
pass.
actually a major.
I'm going to actually start to shoot for the competent column, not the minimally competent anymore.
But if you see also in our work check, we try all as much as we can to go as high as possible when it comes to the quality. Even they always say it's hard to pass here, it's easier to pass NDEB,
True,
if you remember.
it's true, which
This
is
the comment I get a lot too
Yeah.
from our candidates.
which is true. But let me
Yeah.
focus on two things here.
Yes.
If you look at our stats, the one I shared, we didn't say that they pass all the projects in the mock exam.
No.
It's tough.
Yeah.
It's
Yeah.
tough. We are strict with evaluation, and I know it's tough. That's why when we look at the statistics, it has some leniency in the criteria for passing. So how many people who are in that phase, they did not pass our mock exams, they failed one project, maybe two, they
Many.
passed 98%. I
Yeah.
just showed the numbers.
Yes.
98%.
Yes.
Which means we are strict with evaluation. But you went to the exam, and NDEB now determined, not us, this project, you did not pass it.
Yes.
Okay? So when NDEB said your class 4 did not pass, now when you come back, your attitude should be, I'm not gonna aim for minimally competent here anymore.
I need to make sure I get
I need to
competent
make
all the
sure
time.
I'm gonna get the competent
and
Yes.
competent.
here. I'm gonna go for perfection in this project, and instead of saying no, this can pass. Okay, it's two different attitudes at two different
Approaches as well.
situations.
It
and
starts with
approaches.
acknowledgement. Back to what you're saying. It starts with acknowledgement.
Yes, yeah. Acknowledge that.
that.
Okay, how can I make it better?
Very helpful. Yes.
And
very helpful.
ask, and don't be on the borderline of grayness. Don't let these minor things and subjective things be there, because a flush is always a plus from before COVID.
Yes, ACS.
And ACS,
Yes.
it was an A plus, and a detectable was A, and a void goes into D.
D,
That was the
yes.
previous criteria. Now when you come to minimally competent and competent, by the way, it's the same. It's the same way of evaluation. So the minute you put yourself in a detectable situation, you're leaving it up to me.
That's true.
I'm the one who's gonna decide that
That's
it's
true.
okay or not.
Exactly.
So if I happen to be someone who's so strict and I decide it's not, you're
I
done.
won't pass it.
But give me a flush margin. Whether I'm strict or not, I'm not gonna be able to say anything on the flush
No
margin.
comment on it.
Okay.
Yes.
Yeah.
Wow. And also, just to touch base on that, I know we developed a new package for Dr. Nidhi, for example, that struggles with the same project with skills. I believe that we have a clinical mock only package where they can come and do as many clinical mock exams as they can here
Yes.
at Prep Doctors
Yeah.
without having to go through the journey. So just to answer Dr. Nidhi's, feel free to reach out and you can sign up for such a package.
Yes.
Okay, so now very resourceful tools and clinical skills.
Yes.
I would like to move on to the second component of this exam,
Okay.
which is situational judgment.
So I'll start actually by just, if we can have the stats again, the graph, just to look it over.
It's very interesting.
So that we started with skills, by the way, because it's a
Yes,
stressful part.
it's
That's
stressful
why you
part.
can see Dr. Ban has been going through that for a while now.
Yes.
Okay, it's at the tough part of the NDECC. So the situational judgment is a better exam. Why is it a better exam? The nature of the exam itself allows for failure. So that's a big difference. In skills, you have to pass everything.
Yes.
Here, you have to pass 6 stations and don't fail a competency. So the minute you have room to actually have a hiccup in the exam, the passing rate obviously is going to be
Sure.
higher. This is normal.
Yes.
And that's why when we first started, actually now I'm going to look at the 4 cycles and comment on that. Cycle
And
1.
which one are done?
Cycle 1, we were above the 60, in the middle between 60 and 70. Then cycle 2, look at the dip, it dropped below the 60. It was almost 55. Then it picked up again to the 70, and then this last cycle, we're proud to say it's 80, but we want it to be in the 90s.
Yes.
Okay.
Wow.
So why do we have this pattern? This pattern, actually, we saw it coming from the mock exams we do. It's the way people behave. And when I talk about the way people behave, I don't want to sound negative here, but you know, under stressful environment and stressful conditions, people became strongly influenced by information that is outside, and they look for a shortcut and they want to pass, right? And they get afraid when they see people not passing. So if you speak to anybody who went in the early cycles, they had to be themselves. They have no way. They had to be actually
Yeah.
themselves in the exam.
dentist that they
Yes.
are.
Yes.
Yes.
So because they were like, okay, this is a new exam, I'm gonna go there and give it my best. So they had to be on their feet.
Mhm.
Now, when they went to the second exam, they started to learn about competencies from their friends. So they're
Yes.
like, okay, patient-centered care, it's a competency. So now they started to go and say, in patient-centered care, we have treatment planning, let's say. So I'm gonna actually memorize now the root canal, I'm gonna memorize the denture, I'm gonna memorize the extraction, I'm gonna
Mhm.
memorize all of those. So they started to memorize. And we saw that coming. How? Because since the first course, I was trying to break a misconception. A misconception in the name of the exam. The exam is called situational judgment, but the exam is communication. It's actually a communication exam. You have to speak in 5 of the 10 stations. It's a
Yes.
communication.
Yes.
So I told them from the beginning, we have 2 skills exam. One skill is manual dexterity, one skill is communication.
But they're both
And-
practical in a sense.
Yeah, and one you communicate in writing, one you communicate in verbally.
Yes.
They're both communication, because the information that you need to know for this exam is way less than AFK. Way less. We're talking about the clinical aspect over here.
Of course,
But when
definitely.
we come to the communication is important. So in the beginning, we focused on communication, heavy communication component, communication collaboration, and people adopted it. People adopted it to, I believe, even a level beyond what's
What we
needed
want.
from them in the NDEB in terms of techniques, in terms of summarizing, teach back, open-ended questions. So we went in depth in the communication. Okay. When it came to the second cycle, we started to see people are memorizing. They're memorizing answers and communication techniques. So they memorize what's the advantage, disadvantage of root canal. They're memorizing what's the advantage, disadvantage
Yeah,
of this.
without that personal.
Okay, so what happened now, they
understanding
started to
approach.
come in our mock exams. They go in and we see the rehearsing. They are rehearsing the
It's like
answer.
repeating the
so we're
same
like,
answers.
okay, you're being a robot now.
Exactly.
You're not being...
That's not a good thing. I
It's
believe.
not a good thing. And we were actually the first people. We acted in the
Yes.
beginning.
Very first cycle.
Yeah, the first cycle, we did the one-on-one discussions in the first cycle. So we saw that. So we told them, please don't do it, please don't do it. And then they started to get into black and white way of thinking, which is very dangerous
And
here.
it's not the black
Like, what's the
and
right
white.
answer? They start actually to go and ask AFK kind of questions. And they were not the right answer. And we were telling them, this is not AFK.
AFK or ACJ.
Just have a rationale,
Mhm.
answer why you have this judgment, communicate and be yourself, you're gonna pass. It's not rocket science, this exam. And to break that, again, we started with a course and the practice was in the course.
Yes.
Then we added a practice, and the practice was a group practice. Then we added a mini mock, so they actually have to go through the stations themselves. So all of that was happening then. When we got to the third cycle, that was established. It was established before the roadmap of situational
It was
kicked in due to the nature of the exam, kicked in before. So
A bit
people had
earlier,
mini
yes.
mocks. heavy practice sessions we focused on in the third cycle. So we saw a bounce back that was quick. And what helped out actually, and here I want to give the credit to Dr. Luca, is that he had a meeting with the NDEB, and the NDEB also helped out in this aspect by them telling people clearly is don't rehearse. So they actually released tips. They released things like don't rehearse, it's communication, don't divert from the main competency. So they guided people in this exam, which was aligned with what we were saying before. So I would like to thank the NDEB for making our life easy here.
Yeah.
Because there was alignment between us. And then people like, okay, now Prep Doctor were saying this, NDEB are saying this, let's get back into improving our communication.
And did you notice an improvement in the curve?
Oh,
Yes.
huge.
Definitely.
Huge. And we got, and the last cycle, it's great. We got back to 80.
We're gonna get to 90.
Yeah,
Next
we-
time. Like we will work on that.
Because the amount of information is limited in this exam. Like in terms when you look at patient-centered care, treatment plans, the common treatment plans, they are actually, they start to repeat when you teach them how to treatment plan. Like it's a root canal, extraction, you know,
Yes.
that the treatments is very common. The main
Yes,
thing,
general and
when I
basic.
work in a clinic, the diagnoses may differ, but I find myself the majority of the time, when
Doing
someone
almost
comes
the
in an
same thing.
emergency, I'm actually discussing an extraction versus a root canal.
Yes.
That's a very common emergency we get in dentistry. But I may have a patient who's afraid, I may have a patient who's angry, I may have a patient who doesn't want to ask questions. So it's different attitudes with the same treatment plan, which means it's not about I already know what's root canal and extraction and what's their advantage, but I have to communicate with this human being
Of that
who's
situation,
afraid.
yeah.
Who I have to
Yes.
communicate with this person who's angry. So the communication part is very important.
It's about the management as well, because I always tell them that you may don't know something in a station. As long as you acknowledge that and you know that you tell the patient what exactly you're supposed to be doing in this case, you get back to them, you get that information, and you move on with it. But my question is, or in general, with everything we do right now, like in terms of the courses, the main course, then we have the mini mock, then we have the mock exam. People are always asking this question: is that enough? What do you think?
I think it's more than
It's
enough.
more than enough,
I
right?
think it's more than enough. If people use it, like, last week I was, last week or this week? No, this week actually I was giving a lecture, right?
Yes.
So I was talking about the layman language. So they said, okay, how can we prepare for this? I said, talk to a non-dentist. This is a component of the exam. You should not be practicing between each other. Don't practice with your colleague here, because both of you know the dental terms.
Terminology
Go talk
is
to
a
someone.
complex
If you
term,
have,
yes.
especially, I even mentioned talk to engineers,
Yeah.
because they're the furthest away from dentistry. So talk to engineers. If you have a husband or a spouse or a wife that's an engineer, even someone in school, someone in a totally different field from a family, a friend, try to explain to them root canal versus extraction.
In layman's terms.
You're gonna be
Yeah.
forced to go to layman because
Yes.
they don't know the dental terms. And that's how you start to develop it. Why for us it's easy? Because we practiced. We started to talk to patients in the clinic. So in the clinic, we get the general public. You have to speak in layman to the general
Yes.
public. For them, it's different language because English is not their native language.
Yeah.
And they already speak it, but for the past years, they have been actually studying in school and doing AFK and
It's all about
ACJ.
knowledge.
It's all about dental language. They're just talking in dental language. So they have to break away from that. So that's an example of how to practice for the layman. But in terms of content, in terms of practice and all of that, I think it is more than enough. And again, people have to prove themselves in the mocks, and the results that we are achieving and what's happening is actually very promising, that we can
Yes.
even get close to the 90.
We can rely on that as well. One of the things I always was surprised when I see those graphs is how numbers are making when you put them on a graph or when you put them
Yes.
on an image. It will look way different, because usually when we look at it once by itself, it
It's
doesn't
different.
make the same impact.
Well, what we're gonna see in the future, and this is actually something that we adopted here at Prep Doctors, is to frequently do this. But what we're trying to get in the future is to even have graphs of the most common errors in skills, and that's what Dr. Ban and I are working on in the LMS, is like to see, okay, it's a crown, that's the worst one, but not even that the PFM is the worst one. What's the worst criteria in the PFM that people
Very
are
specific.
struggling with?
Yes.
So we're
Yes.
getting to that level
Yes.
with this, with the system. So this is
And
something
having
that,
the big pool of students will actually help you generate
of course,
accurate
yeah.
data.
Okay, I have like two concerns here. First of all, I have the doctor is asking regarding Calgary location, when they're gonna be starting for these skills. Yeah, skills exam, mini mocks. Oh, so skills and the mini mocks.
So Dr. Ban is already ahead of the game in this
Yeah.
aspect because she does the educational team.
Yes,
So the team is already ready.
This is already ready, right?
Yeah, but the construction is actually, so we are on top of it. The planning is done. The implementation is gonna start soon.
I just want to clarify. This is regarding the skills, and I will be talking in a bit about the mini mock and how we
Yeah,
will be
it's a we're building there actually in all of the centers now, just so people are aware. So I'm gonna talk here about logistics. In Richmond Hill, we are gonna be broadcasting the situational judgment,
Yes.
the course,
Yes,
because our candidates who are in Richmond Hill, they have to drive to Mississauga, so now they don't have to.
exactly.
So in a week, that's gonna be there. So it's gonna be the next door unit in Richmond Hill. So that's gonna be a relief for
it's like
people.
literally door by door, right?
It's door in,
Yes.
next door, and they're gonna have their own computer lab.
Yes.
Now, the only thing in Richmond Hill is due to the limitation in the space. Only the practice, the mini mocks, and the stations. They just have to come here to go through those,
Yeah.
and it's gonna be a lot less in frequency than a course and the mini mocks.
Exactly.
Yeah.
Exactly. So they will have to do.
But
the
when we
mini
come
mock.
to Montreal versus Calgary versus Vancouver, we're actually setting up the location so that it has it supports mocks of situational judgment, which is rooms, and it supports skills as well.
Yes.
So the full service that actually people experience here is going to be replicated there.
Yeah, and we will be doing that like in the upcoming few weeks, I would say, right?
The Calgary, I wouldn't say a few weeks. I would say like 8 weeks, 7 to 8
2
weeks.
months.
I would
Yeah.
hope by
With
next
construction,
course
with
will
construction, next course for sure.
will be
Yeah.
live. and
Yeah,
that's-
but we're hoping even before the next course. And but construction, you know what, you never
Yeah.
know what thing when they start
The
demolition and
delays,
delays and
yes,
stuff like that.
of
So
course.
it is coming, and also Vancouver is expanding. So we're gonna also expand the Vancouver because of the waiting list that we have, and we're gonna also we try to implement the mock exam of situational judgment there without rooms. It wasn't a success. So now we are building rooms
Yes.
so that it actually can be they can
replicate the
replicate
full simulation
full
experience,
yes,
as here in
as well.
Mississauga.
Do you want to say something, or should I get from those? I have a few questions here
Yes,
still.
go.
Okay, so I have doctor. I think her name's Ala. She's asking, or Ala, I'm not sure what is the name. How she will be managing the time from now until November registration for January or February 2024. Now I'm doing second training skills.
Okay, so she didn't get
So,
a spot.
she did not get a
She
spot, so she will be
Very
trying to get a
common
spot
question.
in November.
I've been dealing with this
We have
question
like
for
Faris, right?
weeks.
He's
Depends on
already-
performance
he's
and
already
recommendation,
first.
like
That
that.
has the same thing.
They have to continue practicing, I believe, but
Yeah, the thing is,
She's asking about managing time specifically.
managing time. Yeah, I know. So what's gonna happen with this is the burnout that they're gonna run into. So let's say we have two kind of people. If it's someone who after 6 months they are not ready, then this is to their advantage because they have more time to actually get ready,
practice more.
to
and
practice more.
brush up on their skills.
And if it's someone who is ready, this is the tough situation. Like
Exactly.
we've had candidates who we told them you actually can't go to the exam, then they didn't get a seat, and they couldn't get a seat with the NDB, and now they're like, what should I do? They know the answer to that. They know that they can't stop practicing because you have to keep your
You don't
hand
lose
running.
your hand,
Yes.
But the problem becomes more time, more financial strain on them. They're gonna start to get burned out. So for those candidates, if they are at a stage that they are in a good position, I advise them that continuous practice is not needed anymore. You don't need to do continuous practice. You have to do quality practice.
Exactly.
And quality practice is like you're gonna do, let's say, 2 mocks a week, and that's it.
Sometimes
Exactly,
even
just
less.
Sometimes even less than
Yeah.
that in the beginning,
Depending on
and
the
then
level
towards the
of
exam.
Exactly.
Yeah, and the idea is just to keep their hand warm and running, and not to miss the skill,
And not to get tired as well.
and not to get carpal tunnel
Yes.
by the time they get to
I've
the
seen
exam.
a lot of our candidates with
A
the
lot of them,
braces
yes. It's a
on their
common
wrist,
problem.
yes.
Yeah. So that's what I would recommend. I would recommend something like
something light, like during the week, so just
One
to
or
keep
two
up
mock
with
exams
it.
per
Exactly.
week.
Yeah.
And then when you book in November, do you suggest that for when you book in end of October or November for the January exam, do you suggest they go into full practice again?
Now, of course, before their exam, like at least you talk about a month before their exam, they have to go into full
They have to go
practice.
into
Yes,
full
They have
practice.
to go.
they have to be like into the
Yeah.
mood of the exam
Yeah,
itself,
which is the
and
pre-exam
try-
clinical practice that we offer here
Yes.
at our facilities.
Exactly.
or at least the mocks.
Like a couple of days ago, I was talking to someone. They said I have an opportunity to do part-time job, and I couldn't get a seat. I said take it
Yeah.
because their level was good. I said take the part-time job. It's gonna help you. Keep practicing and take it. And he's like, I have a unit at home for now. I said, yeah, keep practicing, but you don't need to do heavy.
Yes.
Do part-time job. That's gonna relieve you financially.
And I feel like it
And
helps
the
their
routine
psych too.
change the
Exactly.
It
routines
helps
as
their
well.
psych
Yeah.
that they're doing something different, a little change, you know,
Yes.
so they're not
True.
always in that stressed.
Another question for you, Rafik.
Sorry, man.
When you going to launch the new roadmap cycle?
The new roadmap cycle.
Yeah.
So depending when are you starting, when we first launched our roadmap, June 19, we had candidates that said, can I sign up for the roadmap, but can I start in the October cycle?
Yes.
Yes, of course, you can start the roadmap, but as long as you respect the roadmap and you take it fully step by step, then you can enroll it whenever you want.
But basically, we can say they can
It's
start
4
as
times
soon
a
as
year.
possible, right?
And
Yeah.
the
So
best way to put it is
October
4
is
times
the
a year.
cycle, yeah.
Yes.
So
The
our courses
roadmap
will
starts
run
4 times a year. I would say the heaviest start of roadmaps are the cycles after ACJ results.
Yes.
Always.
Yeah.
Yes, but so we have 4 courses a year. But yes, to answer this question, they can start. When can you start? Actually, October 22nd. That's the actual date. Well, you can start the next roadmap.
Yes.
And the other thing is, don't interrupt your practice in the roadmap because the committees, they're built on a 6-month cycle.
Yes.
So you start to get checked after the 3rd month, and then you have 4 checkpoints during the 6th month.
Exactly.
So because someone said, what about I do 3, then I take a break, then I do, no, you're gonna actually disturb the flow.
Disturb the
Yeah.
So it makes more sense than to push it than to start with 3 and take a break and
course,
then
yes.
continue.
Exactly.
Push it and
This
do it
reminds me of a
continuously.
question that I get a lot for situational judgment. So I finished the course, and Dr. Fersan, what do you suggest that I do for the mini mock or the situational judgment practice course? I know it's 12 weeks. Can I take 2 weeks now and then take a break, take 4 weeks?
Yeah.
So can you answer a little bit about that?
Okay, so regarding our mini mocks, usually we have we set those 12 weeks, so everyone will get a different training every week. Okay, so to have the complete experience of those questions or those tasks, they have to do them one by one over 12 weeks in general. If they start, let's say, the 3rd week of the cycle, they will finish the 2nd week of the next cycle, so they will get covered with
Okay.
everything in terms of what we need them to know or what we need them to practice on. Now the problem is they start to miss sessions. At the end of the day, those will not be repeated right away. They have to really do a
Wait
full
for the-
Wait for the
cycle
full rotation.
until we
So
can
in
get
order to
those.
maximize exposure, let's say, to all the stations that we offer, it's good that they respect the cycle and they go through it continuously.
Exactly.
So
And
if I
all
started at week 5, for example.
Yes.
So I'll do week 5 to week 12, and then do I join week 1 to 4 again?
so
the next cycle?
if
Is that
someone
what you
needs
suggested?
that advice, yes, I would always say if you need like the full, I would say, baggage of the mini mock in general, because we have, as I mentioned, 12 weeks covered with totally different tasks during those 12 weeks. Now, if you really want to get that full exposure, you need those 12 weeks. So the only advice I would always advise, let's say you want to take 6, take them back to back. Because if you start to scatter them and take them 1, and then you miss 2, and then you come at one point you're going to be repeating almost the same thing. We always do changes or few changes or updates, but the actual, I would say, practices we put on the mini mock is basically like totally we have it to cover most of the topics that NDEB already providing in their criteria, and if you really want to have a full practice to touch upon most of the questions, then this is what you have to do.
This is what we need to do.
Now, one thing, Dr. Ban, the LMS for the skills, is there a set date for, because people have to be trained for that? What's the progress on that level?
So hopefully next week we're ready to start with LMS.
Okay, so there's
because
gonna
it
be-
needs also training for the instructors. How we already did
So
part of the
training is
training.
going to finish for the instructors, then you're planning the
Exactly.
The launch of the
clients.
LMS.
The
Oh,
LMS.
okay,
because
okay.
clients
LMS.
also need training as well.
Yes.
Yeah.
Exactly on
Yeah.
how to use it. So
Yeah. Good luck
Yeah.
with that.
It's
Very
gonna be,
excited.
by the way,
We
it's
need
gonna
it.
be. Did you see it for the clients? Or for
What's
the
that?
from a candidate perspective? It is easy.
Of course, I have been working with Faris. I've been the guinea pig. So I've been
Yeah, but
playing with
what
it.
I'm trying to say,
Yeah.
it's just few clicks. It's much
Yeah.
easier for them to
I
understand.
think
But
it's gonna become easy. Yeah.
It's gonna become easy, but I
it
mean,
needs
this is
learning
exciting in the sense that the candidates also will get a break from clinical skills and learn something different.
Something, yeah, new.
Yes,
Yeah, yeah.
that's true.
Yeah.
Now-
Okay. I just have one last thing from my side, which is for people. No, this is it possible to set one-on-one with any admin staff after ACJ exam to guide for the NDECC, please?
Of course, yes. They
Okay.
can book consultations, they can book appointments. We do have a heavy volume of walk-ins and phone calls. So I suggest if you're coming from somewhere far or if you're limited on time, kids, school, book an appointment, feel free. My team and I will be more than happy to guide you through the whole roadmap, explain it. We can actually sign you up for the roadmap, but also draw a mind map for you. Even when it comes to accommodations, how long you need to stay in Mississauga, if you're outside, we can plan the whole thing for you here. But I suggest that you do book in, and because we do have a heavy volume of walk-ins here.
Yes. One more thing is from Vancouver, they are asking about mini mock and the practice session for situation judgment in Vancouver. I can say we are already working on them. They're gonna be there very soon.
Once we get the facility. yes.
Exactly,
Yeah.
very soon. As soon as we have the facility ready, we will most probably gonna be running maybe a 1 week of test. Then it's
And
gonna be
we'll
just
we'll be running a mock exam for the skills as well.
For Vancouver
for
already,
Vancouver, we will be
Yes.
working
Yeah,
on
the
both
we're
full
already-
marks in terms of situational plus
Exactly.
ACS and the mini mark from the perspective of
Yeah.
situational judgment.
Yeah. Sometimes I miss it when you say ACS, because
Yeah.
I said ACS.
It's natural,
Yes,
yeah.
yes.
It's organic.
So Dr. and Dr. Fersan, they're ACS.
ACS, yes.
Yeah.
ACS generation. So
Yes.
Yeah,
yeah.
we are that old. Yeah. Yes, yes.
Yes, it's the experience too. Okay, so any final remarks? to
One
just,
more
wrap
thing,
up?
actually, since the last thing I'll say before we wrap up, the mock exams there, the skills, because last week we had the meeting with Mr. Muhammad Reza in Vancouver.
Yes.
So the typodonts will be provided
Yes.
when we conduct
So-
in the mock exams. It's going to be exactly like in Mississauga.
Yeah. So they don't need to bring their own typodonts. We're working on that. So
Yes, we'll
it's
provide
like
the typodont,
same
the oral
experience
cover,
with
the assessment teeth, adjacent
the
teeth, everything.
and
will be
everything
there.
on us will be. Yeah.
Yes, they just need to
in
bring their
Vancouver.
kit and they're
And do the exam.
be in a good mood to do the exam.
Exactly.
Okay,
This
there
is
is one
very
last.
nice.
I'm not gonna ask after that, I guess. How are work checks done in remote locations?
Okay, so
Work.
check
checks done
sessions.
in remote location. How it's done? So,
So-
basically,
Where is this person from? That's the question.
This is the question. So, Mr. Sam, Dr. Sam, just let us know where are you exactly. We can talk about them in general.
Because in Montreal, yes, you can go ahead.
In Montreal, work check is done there. Like we have our instructors there. So it's
On site.
Like on site. Yeah.
Yes.
There is a committee there.
Already. Yeah. Now
Richmond Hill, there's a
Richmond Hill,
committee
it's there. Still Vancouver. It's
Vancouver
There's-
is we are on our way, but
Exactly,
there is
to
limitation in the
switch.
location itself. We're expanding, and right now it's hybrid.
it's hybrid.
Yeah,
Yes.
it's like
so
between
like
Mississauga
between
and-
online
Yes.
and
Okay.
and the This is
And
how
for
but when-
Calgary, by
for-
next course,
So look, the main thing is because when we first started in Vancouver, it was done like we did it remotely, the work check,
yes,
and it was. And we tried to rotate between Richmond Hill and Mississauga and so forth, so we did it remotely. I personally think that the effect of on-site work check is way more powerful.
Exactly.
The only thing that the challenge we have is we have to select the instructors very carefully, and they all come here, and then Dr. Ban has to train them, make sure they're on the same page, they have to be followed, they have to understand the way the committee works in order to implement the same system. And now the furthest from here is Vancouver for us, so
Yes.
you know that's on the other side
Geographically.
geographically. So in the beginning, to ensure the quality, so we had actually the same, because you know in Mississauga we have a lot of instructors here. This is the largest volume, so we incorporated them with Mississauga, and then until we had enough training for people to be there, to be on the floor. I think we are on our way to become fully on site over there, but at the moment the way it's conducted, it's hybrid, so half of the work checks are done here, half in Vancouver, unless some people they opted for fully on site.
Yes.
Then they have that option as well. Montreal, we have it's fully on site. Richmond Hill has been fully on site, and Calgary fully on site is going to be fully on site. One thing, however, too, lectures are unified. Everybody gets the lectures.
Every Sunday at 11 Eastern
Yes.
Standard Time.
Everybody.
We broadcast
Demos they have.
Live
access
demos
to
are
all
unified.
the- Yeah, exactly. Yeah.
So almost
Giving the
the
full
knowledge
experience.
everywhere it's the same. Even the instructors, they are instructors who get trained on the same thing. They are doing
Even the
same.
units,
The committees, the heads of
the
the people,
committees.
because committees, I follow one of them, for example, Dr. Ban one, Dr. Fersan one, also the same thing there. So we will be joining via Zoom
Exactly,
or
that's-
even in person.
fly over.
On that they fly
Yes.
there, so that the committees also they're being monitored by us as well.
This is very good. Awesome. I believe this concludes today's webinar. I would like to thank you again, Dr. Marwan, Dr. Ban, and Dr. Fersan, for the valuable insight that we had today.
Thank you, Rafik.
And we also would like to thank all of our attendees that attended today with us. This will be posted on later on our socials. Again, please feel free to reach out if you have any questions or concerns about anything that we discussed today, and we will all be more than happy to help you all. Thank you all one more time.
Thank you.
And we'll
Thank
see
you.
you next podcast.
Thank you, everyone.
Thank you.